So I want you to just for a moment, this is a slide that I've used often, which talks about the wide range of body effects with COVID-19. And so did you really see all these things?
This is 100% true. And as I mentioned before, not only did we see this, but we saw this very early on and we saw it very quickly. And this was, we were learning about this virus in real time, but we just could not fathom what was happening to our patients and how quickly, because these kind of multi-system, we call it a multi-system effect, from diseases, we can see this occur in our patients that are critically ill in the ICU, but those patients usually have been fighting, disease or sepsis or something for some time. And this is, the end result of all of these, all their organs being affected. We're talking about people coming in right off the bat, maybe just a 10 days, 7-10 days of illness, and all their systems were now shutting down. And we were seeing these myriad of symptoms. Like I said before, we were talking so much about, SARS-CoV-2 being, a respiratory virus, and people are just thinking that, okay, it's just going to affect your lungs. But no, we saw very quickly what was happening, and we continue to see this. And, we've learned quite a bit about this novel coronavirus, but we've never really seen any other coronavirus really have this kind of impact, and this degree of, this inflammatory effect that we see.
I think the mechanism by which all these things are occurring is still being researched. We know that it affects the early immune system in unusual ways. And then we know that even when people who survive the hospitalization or survive the infection, that there's something called long hauler syndrome. Can you just share how often you see that among your patients?
This is something that's really important to highlight because, I have many people that I speak to regularly, who may not have underlying medical conditions, who may be younger, who still have that notion that, even if they get COVID, it will be something mild, or they may be asymptomatic and, it's really not going to affect them. Well, whether or not you're hospitalized, we do know that people that have been hospitalized, and especially, with more severe illness that have needed ICU stay and survived, they do suffer from long COVID for an extended amount of time. But we also know people who are asymptomatic, meaning they have no symptoms whatsoever, tested to be positive, or even people that have very mild illness, just a little, cold, like, flu-like syndrome, and you're better in a few days. They are still suffering from these long COVID symptoms. And as I mentioned before, as we talked about that slide that you were showing where SARS-CoV-2 is affecting so many different organs, well, this is what we see in long COVID too. Patients are suffering, not only do they have, chronic fatigue, they have something called brain fog where they can't concentrate. Their memory is being affected by this. They just don't feel like themselves. We talk very often about losing the sense of smell and taste. That is something that can persist for a long time for people. Now, that might be one of the just a nuance and not something so severe, but when you're talking about having physical disability because of, overwhelming fatigue, because of not being able to concentrate, you're talking about your livelihood. You may not be able to work. I have young patients who were, athletes and they can't walk a mile without feeling breathlessness, and they can't go about their normal routine. They have severe disability, even people that have really had mild illness. So the people that have had more severe illness, serious illness, who have needed to be hospitalized, they are suffering for a much longer amount of time. And equally so, I have patients who really are not that sick, but they still have some of these symptoms overlapping, and they can't function the way that they used to before their illness. And it's
this is not the flu that you feel bad, maybe a week, 2 weeks, maybe 3 weeks, but then you really get back to yourself. You're saying this happens quite frequently for either mild or hospitalized persons.
Exactly. And this is something to be taken seriously. Not only is it affecting your lungs, but it affects your heart. People have issues, with they have different heart rhythms where they have issues, chronically now for months on end. We have people, something called cardiomyopathy, people are dealing with that. There was a study that came out a while ago, early on, looking at athletes, the Big Ten athletes, and how they were suffering from, this condition of the heart. And, so this virus causes a lot of damage to a lot of organs and muscles and things that are vital in our body that we don't even understand or think about. Most of us just take for granted a functioning, healthy body.
What do you do to treat people, or what do you do to help people who are dealing with the lung syndrome, or can you? Is there anything? What do you recommend?
So right now, there's actually a lot of research being done on this. In fact, NIH has several grants that they're getting these research studies going to really study this long COVID, because as you mentioned, we don't even know why the SARS-CoV-2 virus does all the things that it does. And then now we're trying to understand, why are people suffering from these symptoms? You know, being in the ICU, being in the hospital, that's trauma in itself. So we can understand some of that, where people, once they're released from the hospital, but the actual changes we have seen on, you know, MRIs of people's brains and CAT scans, we've seen the changes that they have actually in their brains from having, you know, this disease.
But I don't think the virus replicates in the brain, as I understand it. There's something going on in a mechanism that affects the tissue.
Exactly. So, and that's what we're trying to understand. Once we understand the implications and what is causing this, then we can try to figure out how to really alleviate some of those symptoms. Right now, there's nothing. You know, for long COVID, it's just about, you know, giving symptomatic therapy. So making sure that people, you know, if they need inhalers, if they need, you know, intermittently, they need some steroids to help with their breathing, if they need medications to slow down their heart rate because it's going too fast. You know, there's lots of different things that we can do to help with that, but there's no magic solution at this point. You can't fix it. There's not, you know, the virus, we don't even have a magic bullet for the virus, right? We're so far into it, we don't have a cure yet. The things that we have that have been, you know, tested and tried and have shown some benefit, they are, you know, relieving some symptoms. But in the end, if we don't even have a cure for the virus, it's difficult to have a cure for the lingering effects of the virus at this point.
Wow. So with long hauler, the virus is also not there, right? I mean, if I recall that there's no virus isolated, people are not shedding virus necessarily who have the long COVID syndrome. So we don't understand it. And that just brings us to the fact that people who are hesitating to get a vaccine that will prevent disease symptoms, some of them up over 90%, are running the risk of all these things with the disease and a virus that we don't understand, when there is the vaccine, which, yes, we don't know the long-term effects, but we do know short-term that it protects against those symptoms. So I'm glad we're having this discussion tonight about what COVID-19, what you have seen. And many of us followed New York because we were watching television and we saw what was going on the East Coast, when our attention was drawn to the West Coast, supposedly for blocking this virus from entering. It was already here.